Good afternoon, and thank you for joining us for our Facebook Live chat today. We're going to learn about child life specialists and their role in the healthcare team. Now, going to the doctor or being in the hospital can be a scary time when you're a kid, and that is where a child life specialist can help. Joining us is Stephanie McNaughton, a certified child life specialist here at CentraCare. Thank you for joining us today, Stephanie.
Thank you for having me.
Now, what is a certified child life specialist?
So child life specialists work with kids and families that come into the hospital or clinic. Our goal is to help promote positive coping and understanding of whatever the medical experience they're going to have. So we do a lot of preparation, education, support for kids through tests and procedures and whatever their new diagnoses might be. We do this through medical play and also just normalizing the environment and helping kids feel more comfortable and promote healthy healing through play.
How important is play? I mean, kids are familiar with getting to play. So how important is that when they're dealing with health issues?
Play is an essential part of a child's life. So whether they are at home or at school or here in the hospital, play is a great way for kids to be able to tell us, for caregivers to be able to see different misconceptions that they might be having. So for a child life specialist, we can see a little bit more of what they are thinking about regarding tests or procedures and help clear up those misconceptions. It's just their way of learning and their way of feeling safe.
So what is your role as a child life specialist on the healthcare team?
We are a part of the multidisciplinary team, so we collaborate very closely with the pediatric nurses, the providers, the other staff on the team with the best interest of the patient so that we can come up with a plan together with the patients, the parents, and the staff to be able to do the best care as possible.
So why is it that you decided to become a child life specialist?
I always knew that I wanted to work with children and always had a passion for working with children. When I was in high school, my dad had a stroke and we spent 5 weeks in the hospital with him. And that was really where I had my first encounter with being in the medical environment and knowing how scary it was for my family, but also being able to see the supportive staff that we encountered made me really want to be in the medical environment as well. So when I learned about child life and all that it had to offer for children and helping kids understand and learn about what they would be going through, I knew that that's what I wanted to do.
So a child life specialist not only helps children who maybe are sick, but it helps children who maybe have a family member who's sick?
Yes. So we can help support children of adult patients or children who have siblings who are ill too, providing support to parents of how do I talk to my child about my new diagnosis or about our loved one who's here in the hospital, whether it's because of a trauma or something else significant that had happened. We can talk with the families, talk with the siblings to be able to provide that support to them as well.
So if a parent feels like their child could benefit from getting help from a child life specialist, what should they do?
The best thing for families to do if they do feel that they could benefit from child life services is to talk to their primary care provider about whatever the need might be. If there's an upcoming test or procedure and they want some child life support, they can talk with their provider to see if there can be a consult placed to see if child life would be available.
Now, where is it that you actually work? Do you work in the hospital? Do you work in a clinic setting? Do you work at home?
We work here at CentraCare. We have 2 child life specialists. We work both here at the St. Cloud Hospital in the Children's Center unit and at the Pediatric Short Stay Infusion Center at the CentraCare Health Plaza. We are both Monday through Friday, and we can also go to other units throughout the hospital as needed.
So we touched on this a little bit, but what's the difference between a child life specialist and a pediatric nurse?
There is a significant difference between child life specialists and pediatric nurses. Child life specialists do have medical knowledge, but are education, our practice is really focusing on the coping needs of the child and their families. So whereas the nurses are carrying out the medical procedures, we are there during the medical procedures to help support the child and their family in the best way possible.
What kind of reaction do you get from parents when they learn that you're there to help their children? This is something maybe that they had never heard about before.
Mm-hmm. Yeah, so child life is oftentimes a new term, a new profession to families that we see here. And after introducing ourselves and our role to the families, they're very appreciative and they're very happy to hear that there's somebody who is here to support their child throughout this entire experience that they're here. And then being able to support the child also helps to support the parents because parents are often scared and nervous and anxious about the hospitalization as well. So being able to provide support to both is just really beneficial for the whole family.
How is it that you're able to support the parents through something like this? It's not just the children, but it's the parents.
Yeah. So parents definitely need a lot of support too when they're here in the environment and it's new and scary to them as well. So we talk to them about ways that they can support their child. If this is something that their child has never been through, we can advocate for comfort positioning so that parents can be present during a procedure. Parents can be holding their child on their lap or at least being up at the bedside and kind of explaining to them what is going to happen as well because they may not know that. So being able to give them the tools and the information that they need to be able to cope will also help their child cope.
This is probably an odd question, but what is your typical day as a child life specialist? Because I'm sure it's different every day.
Yes, so our typical day varies a lot based on the patient needs for that day or who is here at the hospital on a given day. But the majority of our time is spent seeing patients and doing some preparation and education for any tests or procedures that they might be having, providing therapeutic or expressive activities, art activities to normalize the hospital environment. We provide resources to children of adult patients or parents of other patients that might need the support. We help to coordinate and coordinate different donations that we might have. We also supervise volunteers and really just visiting with the families to be able to support them through their stay.
Well, I'll ask you one more question is what is your favorite part of your job?
The favorite part of my job is being able to help a child get through a procedure. Oftentimes kids are very anxious and very nervous about their procedures, and so being able to walk them through it and seeing the look on their face when they've done it, and being able to empower them through the entire procedure, and they're just so excited and so proud of themselves when they've been able to do it. That's just really truly the best part, is seeing these kids develop these skills that they'll carry with them for their life.
And again, if someone is needing the services of a child life specialist, what's the best thing that they can do?
If they're here in the hospital with a child or in one of the departments and they feel that child life might be an appropriate support for them, they can certainly talk to the medical team, their nurses, providers. If they have an upcoming procedure, they can certainly talk with their provider, their primary care provider, and see if child life would be available.
Okay, great. Well, again, thank you, Stephanie, for joining us today for this Facebook Live chat. Now, if you'd like to learn more about child life specialists, you can head to CentraCare's website at CentraCare.com, and you can just search Child Life, and we'll post that link in the comment section as well. And as Stephanie said, if you feel like you or your child could benefit from the services of child life specialists, then you can contact your primary care provider. So thank you again, Stephanie, for joining us today. And thank you out there again for joining us. And we hope everybody has a wonderful day.